Title: Leprosy in the U.S. on the rise. Old meets new, an unexpected health mystery in Florida. TLDR. A recent report highlights an increase in leprosy cases in states like Florida, doubling over the last decade. But chill, it's still rare, though. Researchers are scratching their heads, wondering how this old-school disease is spreading locally. Armadillos are off the hook, and the 54-year-old Florida man with leprosy hasn't been anywhere suspicious. So what's up with leprosy in the modern world? Disclaimer: the information provided in this article is not medical advice. Always consult a healthcare professional for personal medical concerns. An unwanted blast from the past. Remember leprosy, that disease that sounds straight out of a history textbook? Well, guess what? It's back, baby. According to the Centers for Disease Control and Prevention's medical journal, there's been a spike in leprosy cases in 2020 in southeastern states, mainly Florida. What makes it even weirder? They can't trace the source of some infections. Like, this 54-year-old dude in Florida didn't travel to any leprosy-endemic countries, hang with armadillos, known carriers of the disease, or even know anyone with leprosy. How wild is that? The mystery unfolds. Now, before you start packing up and moving to Antarctica, relax. Leprosy is still rare in the US, but the presence of cases without clear causes has scientists puzzled. Could it mean that leprosy has become endemic in the southeast? And why Florida of all places, the Sunshine State with oranges and theme parks? Central Florida alone makes up 81% of all cases in Florida and 1/5 of all cases across the country. Other states in the Leprosy League include Texas, Hawaii, California, New York, and Louisiana. What's the 411 on leprosy? Also known as Hansen's disease, leprosy is a bacterial infection affecting the skin and nerves. And no, it's not something you can catch by high-fiving someone with the disease or sharing an elevator. It usually requires months of close contact to get it. Interestingly, some people in Brazil got it from contact with armadillos. Now, that's an unexpected twist. I mean, armadillos? Really? The good news. Contrary to the medieval doom and gloom, leprosy is curable. A multi-drug therapy that lasts between 1 and 2 years can kick this ancient menace out the door. Early detection is key, though, so don't procrastinate if you spot any weird symptoms, peeps. The cultural perspective. Once considered a divine punishment, leprosy was the biblical cancel culture back in the day. People with leprosy, or lepers, were forced to isolate or live in special buildings known as lazar houses. Times have changed, but the sudden resurgence of leprosy is still a medical riddle that has health experts intrigued. What could be causing this unexpected spike in an age-old disease? How will this impact our approach to health and infectious diseases? Conclusion. Leprosy is making headlines again, but there's no need to panic. It's treatable and still rare. However, the unexplained rise in locally acquired infections is puzzling. Florida, the state known for sunshine, Disney World, and now, leprosy? It's an enigma worth watching. So, what do you think? Is this sudden rise in leprosy a fluke, or could it be a sign of something more ominous lurking in our environment? Are we overlooking something crucial in our approach to controlling and understanding ancient diseases in modern times? What's your take? Let's hear your thoughts, and remember, don't play with armadillos. Wrong animal emoji, but you get the point.